Can't hear you, Minister Chevy. Can't hear you.
Oh, thank you very much. I was hearing myself. Welcome to another episode, another edition of COVID-19 Q&A. I know most of you are not showing your camera. Thank you, Naomi, for hanging with me and showing your camera. Let's give it up for Naomi Williams. Showing a camera. Okay. I know Miss Delgado always shows a camera. We excuse you for today. Oh, look at that. I know she always come correct. Anyway, so welcome everyone. Today we're going to be talking about COVID-19. We're going to have a short overview of COVID-19 because that's what you're expecting to get. But in addition to that, we have a little bit of icing on the cake. We're going to share about monkeypox. It's all over the news. There's a state of emergency. What is going on in our city? So we're going to give you an overview. We're going to share a couple of video clips that will sort of summarize everything and sort of answer some of the questions you may have as this issue is developing around the world and in our city. Okay, so I'm going to hand over to Dr. Coney to give us an update on COVID-19, what is going on in our community regarding that.
Hello, everyone. Good evening. Thank you for coming. So the news is no different than the last time that we spoke. We're still in a wave of Omicron BA.5 variant. So that hasn't changed. The daily counts really have not changed over the past 2 weeks. So across the United States, there's roughly 130,000 new cases being reported each day. But as we've talked about in the past, those reports may not be accurate because a lot of people are using the at-home test kits. So we don't exactly have an accurate count of the new cases being reported. However, as everyone has heard, the president got COVID and he got, Paxlovid as a medication to treat it, but then he's now with rebound COVID. So he got after Paxlovid, that's one of the risk is getting rebound COVID, and that's where he is right now. So right now, hospitalizations are creeping up, and the number of deaths is higher than it was in early July, but it's around across the United States, it's around 440 fatalities per day. So that's where we are. The recommendations remain the same: to get vaccinated if you're not vaccinated, to get boosted if you have not gotten boosted, and if you're eligible to get a second booster, please go ahead and get a second booster. They are working on a new variation of a booster. So we should be seeing that maybe sometime in the fall, something that will be more reaching into Omicron. But that's where we are. So wear your mask. Don't be fooled. I know out there nobody's wearing masks, but please wear your mask. Wash your hands, especially because people are not wearing masks and they're coughing and sneezing all over different surfaces. And then you can touch that surface, touch your eyes, or touch your nose, touch your mouth, and then suddenly you have COVID yourself. So just be mindful of that, to wash your hands and to spray down any surfaces, especially on the subways and the buses, because they're supposed to wear masks. People are not adhering to that. But when they're sneezing and coughing, those surfaces now can become contaminated with COVID. So it's not just the aerosolized version that we're worried about, but it's the aerosolized droplets that landed on surfaces that you may touch. Okay, So that's all the news I have for this evening. So Sherry, are you ready?
Yes, I'm ready. I was born ready.
Okay.
Welcome again, everyone. A little joke, right? We're talking about a serious situation, but we need to put a little humor in all that we do. Welcome again, everyone, to this platform. And thank you, Dr. Cooney, for that update. And thank you for going straight to the point. And just want to continue to encourage us, even as you said, this wear a mask. Let's just be mindful that we're still in the pandemic and it's still actively spreading, and you want to just protect yourself. Okay, so today we are going to also talk a little bit about monkeypox, because that is really a concern in our community, and the numbers are going up. And we'll just like to share some information that we gathered from YouTube with you guys. So we're going to show 3 videos. The first video is where the governor was declaring the state of disaster emergency, and there was a news clip that I think really goes straight to the point and sort of give an overview on what is going on. So take a listen.
Declared a state disaster emergency as monkeypox cases continue to soar. The governor says more than a quarter of the country's cases are right here in New York.
Please raise the volume.
Vaccines and testing are on the way. With lines for vaccines growing, so are the cases. Now in New York City, up to 1,289 and exploding across the country. People getting more desperate for a shot.
I've been waiting for 4 hours. 4 hours.
While the feds are sending the city 80,000 vaccine doses, that's no relief for those already infected.
They're in such excruciating pain that the emergency department is the first place that they come.
Dr. Virat Madea is on the front lines as a New York City ER doctor.
And the patients that I'm seeing are suffering from pain, but then for weeks afterwards, and sometimes even longer than that.
You have people that have 102 fever, they've got aches and pains all over their body.
Jeffrey Galais is recovering from monkeypox. He says so many people don't know how to get their hands on antiviral drugs like the experimental T-Pox that he was able to get.
They're going from their doctor to the walk-in clinic to the hospital, and they're getting sent away. They can't get the medication anywhere. And, there's maybe 1 or 2 clinics across the city that are offering this, and it's not a sustainable system for healthcare.
The Biden administration is deciding whether to declare a national emergency, but outraged critics are likening its response to the one given to the HIV outbreak in the 80s.
This government pretends to be our friends. This government says that they're LGBTQ allies and they wave the rainbow flag. But if you're saying the same thing that the FDA said in the 80s, then you're not our friends.
So with the slow vaccine rollout and challenges to getting treatments, people are being warned.
It is curable. However, we have to use common sense. This is one of those diseases that lives on hard surfaces. It can harbor itself on a linen. So we need to have a little bit of common sense.
Now, as demand continues to outpace supply, a growing number of states and cities are prioritizing a single dose of the 2-dose vaccine, despite warnings from both the FDA and CDC that both doses are needed. And stay with CBS 2 for continuing coverage on the monkeypox emergency. You can find information on vaccine sites in our area on cbsnewyork.com. Now to breaking.
Okay. I'm going to show the next video. And I want you guys to pay attention to the number. So in New York City, was that you? Did you say New York City? Or yeah, New York City, 1,289 cases. So I'm going to show you another video. Give me a minute. So the video is giving you really an overview of this virus and how did it originate? What is it? What are they? It's going to talk about a little bit about the symptoms and some of the things we have to be mindful of. So there are 2 videos that I will show back to back.
And whether we should be worried. Since early May, cases have been confirmed in countries where it doesn't usually occur, and those numbers are growing. Monkeypox is a virus. If you get it, some of the first symptoms might feel like the flu. Body aches, fever, swollen glands, and then a rash, which typically starts on the face before spreading to other parts of the body. That rash produces flat lesions, which then fill with fluid until they eventually scab and fall off. Most people recover from monkeypox on their own in 2 to 4 weeks. And so far, no deaths have been confirmed from the latest outbreak. But it can be a serious disease.
If you have a healthy immune system, you can pretty rapidly clear the virus. Sometimes there are some bad side effects. So people have gotten eye infections in some cases, and it has resulted in blindness. There's severe scarring that can be seen in some cases.
Monkeypox is what's known as a zoonotic disease. That's an infection that can be passed between animals and humans. It was first identified in 1958 in lab monkeys in Denmark. That's how it got its name. But monkeys aren't the main carriers or spreaders.
It's actually believed that the reservoir, that is the types of animals that are harboring this and sort of keeping it alive in nature, are more likely to be rodents. They might be tree squirrels or dormice or Gambian rats.
The first known case in humans was identified in 1970 in the Democratic Republic of Congo. And now in parts of Central and West Africa, monkeypox is endemic, meaning it's regularly found there.
Let me talk about Nigeria. Between 2017 and now, we've had just about 500 cases confirmed. So really, in terms of number, it's not really a big problem.
Now, there are 2 known strains of the virus in those endemic regions in Africa. The Congo Basin strain is the more dangerous one, with a mortality rate that has reached 11% in some outbreaks. And then there's the West Africa strain, which is less severe and has a mortality rate of around 1%. And the evidence suggests that the current outbreak is linked to this strain. Now, monkeypox has been found outside of the endemic regions in the past. For example, there was an outbreak in the US in 2003. But in that case, and others, outbreaks have always been linked to a person or animal that has traveled from the endemic regions. What's happening now, though, seems different.
What's really unusual about this is that there are so many cases that are spreading outside of the normal area where we normally see monkeypox emerge, and that this is obviously being driven largely by human-to-human transmission rather than transmission from rodents.
So how does monkeypox spread between humans? Well, it generally requires close physical contact.
The pox lesions, the sores that occur with this infection, are full of virus. And if the person who's not infected touches that place where the wound or the sore is, they can become infected themselves if there's a break in their skin.
You can also get it indirectly, for example, by sharing bed sheets or towels that have been contaminated. It can also be transmitted through respiratory droplets, for example, if an infected person coughs or sneezes. But we're talking about large droplets, which can't travel far. So you'd need prolonged face-to-face contact to catch it that way. So keep in mind, in general, monkeypox doesn't spread that easily.
This is a self-limiting disease. It doesn't spread like COVID.
You usually have to have a pretty significant exposure to an infected person in order for human-to-human transmission to occur. And this is thought to be one of the reasons why, when cases have been exported from the endemic area, there's typically not large outbreaks associated with it.
Now, the World Health Organization says that so far the new monkeypox cases reported have mainly been among men who have sex with men. But, and this is important, the common denominator there is the close contact, not sexual orientation.
I think this is kind of a hypothesis that a lot of public health officials are working off of, is that it emerged first in a population of men who have sex with men and therefore began to spread in that population. It could have just as easily broken out first in a heterosexual population and begun to spread that way.
We don't think that monkeypox is a classical sexually transmitted disease. But we do know that it's spread through contact. And so the contact through intimate sexual activity is, in many cases, appearing to be what is driving disease transmission.
The good news is that we have some tools to fight it. When it comes to medication, vaccines and antiviral drugs developed to fight smallpox can be effective because monkeypox is from the same family of viruses. And then there are the other methods of infection control that we're all so familiar with from COVID, things like contact tracing, testing, and quarantine. The WHO advises that the response should focus on the people affected and their close contacts.
Identifying people who may have had risky contacts with an individual when they were infectious with monkeypox, and then offering them option to get vaccine. But certainly to monitor that person closely. And so if they do develop any signs or symptoms of illness, that person can be quarantined and tested. And if they are positive, then they are isolated and cared for.
So this is where we're at. We know that monkeypox is pretty hard to catch. There are drugs that can help, and the WHO says it can be contained. But there's still lots that scientists are trying to find out about what's driving this new outbreak. And that's important. It is a problem that needs dealing with.
I think it's very unlikely that we're going to be looking at a monkeypox pandemic, but I do think it's something to be concerned about. The real risk for monkeypox is that it could be established in new reservoirs, new animal reservoirs around the world, and then it's going to be much, much more difficult to stop monkeypox outbreaks from happening globally.
In case you missed it, we did a recent episode about COVID hitting North Korea. The video is linked here. Remember to subscribe too so you don't miss our next one.
Okay, thank you. I'm gonna get the other video ready to roll. Give me a minute. So some of the things in this next video is similar to what is in the previous one, but I believe it's sharing some information from a different perspective. And I want you guys to take a listen to this one too. This is from CNN.
Of a rare disease called monkeypox, caused by a less severe cousin of the smallpox virus, are popping up around the globe, including in the United States. The monkeypox virus is endemic to several countries in Africa, which means most of the pictures you're about to see in this piece are from past outbreaks in those regions. According to the U.S. Centers for Disease Control and Prevention, the virus was first identified in 1958 when 2 outbreaks of a pox-like disease occurred in colonies of research monkeys, hence the name, monkeypox. But this is a bit of a misnomer. The natural reservoir for monkeypox has not been identified, but is most likely rodents or similar creatures. Now, since 1970, human cases of monkeypox have been reported in 11 African countries, and the first outbreak outside the continent was in 2003 in the United States. Cases were reported across several states in the Midwest, linked to infected pet prairie dogs, which had been housed with rats and dormice imported from Ghana. An outbreak in Nigeria that started in 2017 has been linked to over 500 suspected cases and more than 200 confirmed cases, and that continues today. While monkeypox generally spreads to people from infected wild animals, such as rodents and primates found in the rainforests of Central and West Africa, but human-to-human transmission can also occur. Back in 2008, I went to the Democratic Republic of Congo to visit where monkeypox is endemic. According to the CDC, infection can develop after close contact with an infected individual, such as an exposure to broken skin, mucous membranes, respiratory droplets, infected body fluids, or even contact with contaminated linen. However, monkeypox isn't thought to be airborne like COVID-19. Well, the CDC says 7 to 14 days after infection, the first symptoms usually appear. They're usually flu-like, such as fever, chills, exhaustion, headache, and muscle weakness. The symptoms are then usually followed by swelling in the lymph nodes, which help the body fight infection and disease. Next comes a widespread rash on the face and body, which can also be felt inside the mouth and on the palm of the hands and soles of the feet. Patients also develop painful raised poxes. Those are pearly and fluid-filled, often surrounded by red circles. The lesions finally scab over and resolve over a period of 2 to 3 weeks. So far, there have been hundreds of confirmed or suspected cases of monkeypox where the virus isn't endemic, most of them in countries like the United States, Canada, and Spain. The current outbreak is under investigation, but what we do know is that while anyone can get or spread monkeypox, the CDC says a notable fraction of cases in the current outbreak are happening among gay and bisexual men. Now, monkeypox isn't considered a sexually transmitted disease, but close and intimate contact is a significant factor for spread. The age of people in this current outbreak has mostly been people under the age of 50. Also notable, because older people likely had received the smallpox vaccine before the disease was eradicated, and that smallpox vaccine probably offered protection against monkeypox as well. The CDC says people infected with the virus need to isolate until all their rash and lesions have healed, new skin is formed, and they've consulted with public health authorities. There is no proven safe treatment for monkeypox, but the symptoms can be managed with existing medications. We aren't facing another COVID-type outbreak, but like the coronavirus, monkeypox is another zoonotic virus. That means it jumped from animals to humans and is now spreading between people.
Okay, thank you for that, for listening. I think that really gave us a lot of information. I think one of the reasons why the government is really concerned is for the past, from 2017, for example, in Nigeria, they had only 500 cases from like 2017 up till now. And then in our city, within a span of, I think, 2 or 3 months, maybe not even up to 3 months, we have over 1,000 cases. So even though it's a small number, but the rate at which it's happening is why we're concerned. And then it also says that for you to get it, you have to have a significant exposure, prolonged contact, and one of the things that is driving the disease right now is for men that are bisexual or that are homosexual. That's a driving force now. But as we heard, it's not necessarily just in that people with those kind of sexual orientation. Anybody can get it if you're exposed to it. I heard of a case, even though it's very extreme to get it via lenient, but I did heard of a case of someone that got it through there when they went somewhere. So we just want to be careful. And I think also what was interesting in the piece that we saw from CNN is the fact about the smallpox vaccination, that most of the cases that have been noted are people that were under 50, and people that were over 50 did get a smallpox vaccination in the past. So I think that's also an interesting thing. So we have to also remember this is just a case that's just evolving, even though there's been several times that there's been outbreak, but the development right now is still something that is still discovering and researching and trying to find out if it's different from what we have seen in the past. So let's just continue to be vigilant and just take care of ourselves and just pray, and be careful. So I don't know if anyone has any comments, any questions. We'll try to answer what we can. What we cannot answer, we'll find out an answer for you and not next week. So Ms. Bermute, go ahead.
Yes, hi, good evening, everybody. I had a question because with the monkeypox, it says that it's more prevalent in bisexual and gay men. I just wanted to know the history of that. Why is that the population that's more prevalent to get in the monkeypox?
I mean, the research that I didn't specifically say why. Just like it said in one of the videos, it could as well have started with heterosexual men, but it just happened that the first person or one of the first people that contacted it is somebody that's of that sexual orientation. And of course, these are the people they interact with, and they just continue to spread. It could be something even as simple as saying, let's say, for example, it's spreading in Far Rockaway, people that live around each other. So that's the way I'm seeing it from what I'm reading now. But like it was said in the video, it's still under investigation and research, and then we're going to get more detail. But one thing is certain from past outbreak is not a sexual transmitted disease, but it's happening because of significant exposure and prolonged contact, which happened during sexual interaction.
Thank you so much for that. That was really clear. Thank you.
You're welcome. Any question, comments? Is Sandy on the line? Doesn't want to add anything? I know they had a case in his hospital the other day. Okay, he's not on the line. Okay. Okay, any question, comment regarding the COVID-19 update? Okay, it's a quiet group today. Dr. Cody, do you have anything to add? Beverly is smiling. I have like a link that I want to share. I'm gonna have to go and find it. Dr. Cody, let me just get up and go and find it. It's a link to a website regarding monkeypox from the city that you can get information and updates.
Okay. All right. No, I don't have anything specific to add. Just, be aware. The disease was started off as like a zoonotic, meaning it was in animals, and then jumped to the human population, but was very kind of isolated to certain regions and very limited in its outbreak. But why at this particular time it's decided to spread at such a rapid rate, that's really the million-dollar question at this point. So we have to, do some research and find. At this point in time, it's decided to make that jump. Videos showed it's very close, prolonged contact with someone that has open lesions. And then, you have an open wound and you touch that open wound with the infected area, and that's how you're getting it. I guess with the linen and the clothing, it's because the wounds, open up and infect the linen, and then you go on top of that contaminated surface, and you're in close contact with that contaminated surface, and that's how you can get it transmitted like that. But definitely need to keep an eye on it. These diseases have a way of spreading very quickly, and because there's not enough vaccination doses and treatments for it, because the supply chain line, actually the stores of smallpox vaccination that the United States had expired, and they didn't refresh those expired doses. They expired. So this is why we're in the situation of the supply shortage. So, it's how our government operates, I guess. Trying to be politically correct.
All right. Okay. So I see that your hand is up. All the Sister Ingrid, your hand is up. Then after JT, Ingrid, JT, you have a question?
Yeah, while Dr. Crony was talking, it reminded me of something. A while back, we talked about the difference between sanitizing and disinfectant and what you can and can't use the Lysol for. And so as Dr. Crony was talking, I was thinking, would Lysol be one of those things like the spray that we could use to disinfect the bed sheets for this virus, or no?
I don't know. I don't know that it has been tested against Lysol. I don't, that's something that I haven't seen discussed in terms of disinfecting those kind of surfaces. So I haven't seen that anywhere, actually. It's a good question. I don't know if Lysol or disinfectant various disinfectants kill monkeypox. That's an interesting question.
That's an interesting question. Maybe JT, you can research on that.
I'll put it on the list.
Yeah, put it on the list and you can give us feedback and we can share it with the group. Sister Blackman?
Yeah, I'm spraying a little bit first for the information. Good, very good. Concerning COVID, it remains the same. Mask up. But what I want to, what I'm thinking, last week I could not have come on because I was on the line, and I'm inquiring, and I did not go to church Sunday, so I'm inquiring about the kits for the blood pressure kits. I had filled out a form the first week you put it out, so I don't know if that worked.
Oh, okay, I will talk to you offline. You can text me offline and I will respond to you.
All right, my dears. Thank you.
You're welcome.
So in answer to Jatia's question, yes, disinfectants kill monkeypox. It says monkeypox belongs to a group of viruses that is more susceptible to disinfectants than other types of viruses. While there are no disinfectants registered for use against monkeypox, all products claims have been tested against viruses that are more difficult to kill than monkeypox. So that's from the CDC website. I'm sorry, from the EPA website. So as of May 26th, so the answer is yes.
Okay, thank you, Dr.
Thank you
for that on the spot research. Thank you. Excellent. Any question? Do you have any other? I see something is in the chat. Let me see. Oh, good question. Okay. Okay, so I put the link in the chat where you can get up-to-date information from the Department of Health and Mental Hygiene. You can click on the link, and if you forget the link, you can always call 311. If you call 311, you tell them to share with you what's the link to the DOHMH website. They will gladly share the information with you. So if you're having any kind of health challenges that is not like an emergency and you're trying to find out answer to certain questions, or you want to get in touch with an agency, 311 is always a good place to call, and they can direct you to the right agency and will be able to support you regarding that. Okay, any other question, comment, concerns, topic you want us to explore? Okay, if there are no questions, I guess you guys gonna have about 26 minutes back of your evening, because we'll finish sharing the information we have for the night. And if you guys don't have questions, we don't want to just keep you waiting. Okay, there is something Grace says, will we be also giving pamphlet? Will we be also giving pamphlet regarding?
Yes, Grace, the answer to that is yes. There were, at least last week, there were some pamphlets or flyers in the office.
Yeah, this is where I got the link from.
Okay, great.
Yeah, I picked that from the office this morning. There's some in the office.
And I will see if we can order more.
Yeah, because that's important. A lot of people, I'm sure they're asking the team how they regarding monkeypox. Are you guys getting questions? Tim Relum, when you're on the field regarding monkeypox, are you getting questions? Mr. Walter said yes. I know you're muted, but I can see your head nodding. Okay, great. Excellent. Okay, I see Sunday just joined us. Dr. Sunday, we're talking about monkeypox. I don't know if you have anything you want to add. We share 3 videos regarding it. I don't know if you have any kind of updated information you want to share. If not, that is okay. Easy. I didn't say. Okay, I guess that is a no. Okay, so we're gonna keep it moving. So no question, no comments. Thank you guys again. Oh, there's a question. Is it possible to get a digital pamphlet on monkeypox so it will be easily shared? Okay, so once we get something, we'll share with you guys. We'll share with you on the WhatsApp group. Everyone on this platform is on my WhatsApp group except the intern, I'm very sure. Then I'll share with that group. And yes, I know the city has developed some flyers, so we'll share whatever they give to us with you. We'll make it digital and share it with you. Even if it's not digital, we'll take a picture of it and we'll share the picture with you. Okay, have a good night, everyone. Thank you, Princess Ramos, for joining us. Thank you, interns, for joining us. And thank you, all of our frequent visitors. Thank you, Reverend Gary, Sister Beverly. Thank you, Sister Brother Delroy and the Loom team. I think Sister Sherry somewhere there. That's our voice. Yes, how you doing?
Good night, everybody. Have a blessed
Bye,
night.
Sister Bachman. Bye,
Good
Bermuda.
night, everybody.
Thank you. Good night, everyone.
Good night. Thank you, Sister Beatrice.
Oh, thank you. Very informative.
Good night, everyone.
You're welcome. Good night,
Thank
everyone.
you.
Thank you, Dr. Coney. Good night, everyone.
Have a good night.
Have a good